Welcome to the introduction of the long-term methods. I will take some time when we are covering the long-term methods because most of you people were asking much about the long-term methods. So I'll take my time when sharing about the long-term method. We only have two major long-term methods which we use currently in our country. We have the the IUCD, intrauterine copper device, and we have the one which we said we shall say the implanol and Jadel. So we shall go directly to the intrauterine devices, which is the first device which we said we shall cover, which is which most of you guys really got interested with. We call them commonly the IUCD. And most of you, when you come to the hospital, you say we need the coil. So it's a small plastic device containing copper or steroid hormones. So there is hormonal and non-hormonal that is placed in the uterus to prevent pregnancy. So the one that contains copper, we call it a non-hormonal, and the one that contains the steroids, which are hormone, mostly progesterone, we call it a hormonal IUCD. So the mechanism of action for the copper IUCD and hormone releasing IUCD is more likely or the same. So they tend to release the copper or hormone. So the copper ion decreases the sperm motility, the way the sperm moves towards the fallopian tubes, and function by alternating the uterine and tubal fluid environment. So as we said earlier, when we were discussing other method, it thickens and reduces the amount of the fluids produced. So the hormone has an effect on the cervical mucus thickening also. The way we said the normal lining of the uterus, it's affected. So it has an effect of thickening the mucus and thinning of endometrial lining. So it will make due to reduced production and changing on the chemical content of the mucus produced during coitus or by the female vagina, it makes it thick, and then it doesn't allow the normal thickening of the uterus just before menses to allow for implantation. So sorry, I know I have some change in voice. I have a small flu, but I'm sure you're able to get whatever I'm saying. So we have different types of IUCD and their duration of effectiveness. So we have the copper T 380A, which usually go for 12 years. This is the most common that we have here. We have the T copper 380S, which used to go for 8 years. It's not very readily in the market now. We have copper T200, which goes for 8 years. It's found in some of the private hospitals. We have Genfix, which used to go for 8 years. It's not really commonly available. We have Novati, which goes for 5 years. And we have multi-load MLCU 375, 5 years, which also has become scanty in the market. For the hormonal IUCD, we have two major types, which is Milena and Lingas. The Milena is abbreviated as LNG 201 US, and Lingas is LNG IUS, which both of them goes for 5 years. Most of these hormonals, also you won't find them in the public facilities, but yes, they are readily available in the private facilities. So IUCD is ranked again as one of the best and most effective method of family planning, with a failure rate of 0.6 to 0.8%, meaning only less than one person or 6 people in 1,000 people, in 1,000 women might contract pregnancy when they are using IUCD. I know there are a lot of myths that people really get commonly pregnant when they're using IUCD. And as you can see, the effectiveness is very high. So only a few population of people using IUCD will end up getting pregnant. So advantage of IUCD, the contraceptive benefits, it's highly effective and safe. It has immediate effectiveness as soon as you place it, but normally we try buying time for at least 24 hours. Uh, but according to the books, it's effective as immediately as inserted, and it's very highly effective and it's safe. We say it's safe mostly because it's non-hormonal, most of them, and it doesn't directly affect the production of body hormones. Also, we say it's long-acting protection. We have said it can take up to 12 years, the copper T especially, and the shortest can take 5 years. So both of them are very long-acting method. In fact, it's the only family planning method before the surgical processes that has the most long-acting methods. Also, it's easily reversible. You can reverse the copper T because once you remove, you reverse back to the normal state. And then it's has no systemic effects. We said it doesn't affect any direct to the production of hormones or the follicular and luteinizing hormones. It has immediate return of fertility upon removal. It's not like the one we shared before depot, which will take 2 years. For IUCD, you get to regain your fertility as soon as you remove it. So also, we have other benefits like it does not interfere with the intercourse because it does not interfere in any way with intercourse. Also can be used by women who are breastfeeding. Can be used. It doesn't affect again estrogen, so can be used with women who are breastfeeding. Can be used by women immediately after delivery. In fact, many women who decide during pregnancy, we insert it immediately as we deliver. Also, IUCD, including copper IUCDs, may help protect from endometrial cancers. Again, we said it reduces the stimulation of the endometrial muscles and it reduces the thickening. And by the time it is suppressing the overuse of endometrial muscles, it also suppresses or reduces the risk of having endometrial cancer. Also, mono IUCD may reduce menstrual bleeding or cause amenorrhea. So the progestin hormonal IUCD will help in menstrual bleeding and may lead to loss of the bleeding, bringing to amenorrhea. And if it affects amenorrhea, it also affects the dysmenorrhea, the painful menstruation or the painful cramps during menstruation. So commonly when you use the non-hormonal and you have that severe bleeding, most of the people will end up changing into the non-hormonal or you change to other method. If we place the non-hormonal, the copper, and you have excessive bleeding, mostly we try see if the hormonal one will work for you. And if it doesn't, we can now try and venture other methods. So don't restrict yourself in case you use the copper T and you have excessive bleeding and say you can never use IUCD. You can try the hormonal one, which it's characterized by the reduction of bleeding and may cause amenorrhea. So also it has some disadvantage. One, insertion and removal require trained provider. Not everyone can place it. It requires a trained nurse or a trained doctor to insert and remove it. Also, it requires appropriate infection prevention practices during insertion and removal. You have to practice effective hygiene when placing it and removing it. So it's really suitable for administration in the hospitals. Also, it do not protect STIs like HIV and AIDS, which are mainly protected only by the barrier methods, the condom use. Also, may be expelled or translocated. And I get some misunderstanding by translocation. Translocation, it says it might drop down or even be expelled from the body, but it's not moving from like the uterus and going to the other parts of the body. Also, the perforation, rarely, but very rarely, it may cause the perforation of the uterus. This maybe some people have a reaction with it, and it might end up causing perforation of the uterus. This is a rare case during my practice. I've not seen it, but theoretically, it has been covered in the books. Side effects. It has some side effects like including cramping and increased prolonged bleeding, especially when you're using the copper T. It might bring cramping or prolonged bleeding, which is usually controlled in the first day, like 3 months, when we use by use of the COC, the combined oral contraceptive, and the use of brufen. So method failure can lead to ectopic pregnancy. So sometimes we might have the failure on the 0.6%, which we are saying, which might lead to having ectopic pregnancy. Ectopic pregnancy is a pregnancy you obtain in the fallopian tubes. It doesn't get into the uterus where it's supposed to be implanted. So it will be retained in the fallopian tubes. So again, it's extremely rare for you to get pregnant when you are having it. But there have been reports of you having ectopic pregnancy due to the failure of the intrauterine contraceptives, that IUCD. So we have got a lot of myths about IUCD. Some says that IUCD usually abort efficient, like it leads to abortion. And no, we do say it only prevent pregnancy by slowing down the sperm and movement, but not leading to abortion. So IUCD is similar to other methods, and this has made it IUCD to be inhibited in most of the mission hospitals, whereby they term it as an abortion method. But the fact is, they prevent pregnancy by slowing the sperm and thinning of the endometrium. Thus, it's not true that it causes abortion. Again, other methods, we say IUCD can migrate to other organs like heart or liver. That's not true. It usually stays in the uterus until it is removed or it's dislocated downwards to be injected through the cervix. If it does not come out by itself, it comes through. If it comes out or it's dislocated, it has to come through the vagina. Other people say that it interferes with sex, and that's a false. It's located in the uterus, and the penis does not reach the uterus. So the sex is always in the vaginal canal. So in no way does the partner even feel. Mostly they don't feel the strings. And if they might feel the string, they're usually very thin, and it doesn't affect the uh, sex in any way. So mostly people might have that mental intuition that it's being affected by it. Other myth we find it's IUCD may last inside woman body. No, the material used to make the IUCD will not last inside the body, even after the 12 years. In my experience, I've never seen a lasted. Other myths and misconception, it's some says the IUCD increases a woman's risk of ectopic pregnancy, but not true. In fact, IUCD reduces risk of ectopic pregnancy by preventing pregnancy. So women who use copper-bearing IUCDs are 91% less likely than women who has no contraception to have ectopic pregnancy, because for them they are capable of getting pregnancy, and for those in IUCD they have a preventive method to prevent them from having uh, ectopic pregnancy. And if they might have, we have said it's a very low and rare case. Another misconception that we find is IUCD cause pelvic inflammatory disease. That's where you get pain in the pelvis. And then you have like bones they swell on the pelvis region. So they are saying it leads to that. But uh if you used a sterile method when placing it, it should bring that. So if you use a sterile method to insert, it will never bring the pelvic inflammatory disease, which mostly is brought by infection. Another misconception is IUCD causes infertility. That's not true. In fact, it's one of the most safest methods to prevent infertility. Infertility caused by tubal damage associated with not associated not with the IUCD use, but with chlamydia infection. Moreover, there is immediate return of fertility after IUCD has been removed. So yes, you can get infection which can lead to infertility, but IUCD in no case or in no way does it lead to uh, the loss of fertility. Another misconception we get is IUCD is unsuitable for use in nulliparous women. It's open to any person at any obtainable age where you are able to consent for yourself. In Kenya, when you're above 18, you can consent for IUCD. Whether you are pregnant before or have never been pregnant, any person can use the IUCD. Another misconception is IUCD cannot be safely used by HIV-infected women who are clinically well, and that's not true. HIV-infected women who are clinically well can generally use the IUCD. But for those who have developed AIDS, we might be hesitant in introducing the IUCD. And the main reason is not that because it accelerates the infection or anything, but the main reason we don't place IUCD with people with AIDS who have graduated HIV into AIDS is because it can add more risk to infection during insertion process. And due to their weakened immunity, it might be more stronger. Another misconception is IUCD interferes with ARVs therapy, and that's not true. Women who have AIDS are on ARV therapy and are clinically well and can generally use the IUCD. So the picture shared there, it's where the IUCD lies. So you can see it's inside the uterus, and during intercourse, you don't get to the uterus, you get to the cervix. The cervix is this tip. So you get through the vagina up to the cervix. So in any way, it doesn't affect. It's completely saline into the uterus. So thank you so much. I think it has brought some clarity on the question which most of you guys were asking, but feel free to ask any question about the same. Thank you. Thank you so much for watching this video. I hope you have been enlightened. Kindly subscribe to have an access to more of my upcoming classes on device health and lifestyle tips. In case you have a specific topic you want handled, or specific question you would like answered, or even get clarification on something I've said on my videos, please drop it on the comment section and I'll be prompt to give you responses. For appointment and private session, contact me via details on the video and I'll be ready to assist you. Thank you again for choosing me to guide you on health and lifestyle. This is King Mash. See you on the next one.